Very good afternoon to everyone who have joined us. Thank you to be there with us. We'll just wait for Ruth to join in. Yes. Is it better?
Hi, Nisha. Can you hear me now?
It's very less. Can you increase the volume? I cannot hear you clearly.
Okay, I'm not so clear.
It's fine now.
It's fine?
Yeah. Can you hear me clearly?
Yeah, I can hear you.
So let's begin with our show today. Being a new parent is exciting. Not always. It's not always rainbow and sunshine. The hustle and bustle of post delivery care, latching issues, quantity of your milk, and lot many unexpected challenges that comes your way as soon as you become a mother. Okay, thank you so much, mommies, for letting us know that everything is good now. So let's begin. And as we all know, breastfeeding can be a very smooth journey for many mothers, but not for all. As per WHO global data, around 90% mothers faces breastfeeding issues. Around 40% they gives up on breastfeeding. Do you all know that only 55% babies are breastfed, exclusively breastfed? 3 out of 5 babies are breastfed in the first hour. There can be lot of reasons for all this: lack of information, lack of guidance, lack of preparations, unexpected hurdles, and many more. So today, along with the most trusted maternity chain of hospital in India, we are trying to create awareness around the topic breastfeeding. No one said it will be easy. So let's talk about your breastfeeding journey. For that, let me introduce you to our today's guest, our today's expert. She comes with an experience of 32 years in maternity, allied health, and nursing care, both in rural and urban sectors of India and abroad. She heads the lactation program for 19 different centers of Cloud9 across India. Not only that, mommies, she is the pillar of support when it comes for breastfeeding issues, critical disorders in mommies and babies during the different stages of breastfeeding. At the same time, she is acclaimed to have an expertise in lesser known art of relactation and induced lactation. A very warm welcome to Ruth Patterson from Cloud9 Bangalore.
Thank you, Nisha. Thank you, everybody.
Much, Ruth, to be here.
Yes.
So with I'll not take much of the time. All the mommies who are here today to know more about breastfeeding. Ruth, why don't you share your experience of 32 years that when a mother comes to you, what is the expectation that she has built for herself for breastfeeding, and what is the reality?
Yeah. Uh, Thanks, Nisha, once again for giving me this opportunity to talk to new moms, especially.
Yes.
And when you ask this question, there is too much to talk about it. Because out of my, so many years of experience, I could see the tremendous changes from, the 20 years before to now.
Mm-hmm.
There's a lot of differences there. So what I would say is mothers should be able to accept the change because she was very happy in her career and with the family and mother and the father and the siblings, and the lifestyle was entirely different.
Right.
The moment she gets married, the lifestyle is bit changing. She has to get adopted to the new family. By then she get pregnant. That's again new changes into her body. And she should be well prepared to accept the new lifestyle
Right.
because lot many changes her body go through. So she has to understand and she has to get cope up with the adjustment. It is not just the mother alone has to get adjusted. And since she is new to the system of pregnancy and getting adjusted to the new family, where the whole new family has to support her during this pregnancy lifestyle. It is not so easy how we talk about it. So the new family, new people around, new society, new community, everything she has to get adjusted in that new journey of new lifestyle. And it's quite challenge for a few mothers to adopt to that. So once the family support is the priority, that to new family support, she need the life partner support and the family support is very, very essential when she is going through these changes.
Right.
So during this phase, she has to get a lot of support and happiness during this pregnancy. And she thinks, okay, 9 months, let me come. I have done and I will take the baby out and I will enjoy. Again, the new real thing is starting. Once baby is out, the baby needs full attention of mother.
Exactly.
And mother is not able to go out how she has been doing it earlier. She maybe had work and she used to go out and she loved to shop, she loved to travel, she loved to eat outside. There are many mothers and social friendship, going to visit people, so many things are there. Everything is getting slowed down and a first month of post delivery, so that she should be able to understand before she could deliver the baby, and she should be able to avail the counseling during the pregnancy period. What are the changes she can expect after the delivery, what is expected from mother end, and how the new life is going to be. What is her reality once baby is born? I should be able to breastfeed, baby should be able to sleep well, I should be able to rest well, and I should do my old activities how I was. So which is not going to happen the same. It's going to be little change. That is the real reality. Every woman should understand, and every family behind, they should be able to help them and help mother to understand this. The journey will be awesome.
Right.
Which everybody should get adopted to this change by getting bit of counseling by the healthcare workers, and there's beautiful antenatal counselings are there. She should be able to avail as a couple and get benefited with that. Yes.
So, Ruth, as you said, of course, everything changes the moment you become a mother. And we are still in our sweet that world. Once the baby is out, everything will be sweet and like it'll be very easier. So it's not like that. So help me understanding what is the biggest hurdle as a lactation consultant you all face the moment the new mother comes to you all. What is the biggest hurdle? Stay tuned, mommies. I think there's again a network issue. Yeah.
For a few days or a few weeks, maybe a week, it is quite challenging. I'm not audible?
Ruth, I'm sorry to. Yeah, we just lost you for a minute. Can you start again for this question?
Yeah. The barrier in lactation consultation for the, no, come again your question. What is the hustle? Come again.
What is the biggest barrier you all face when it comes as a lactation consultant?
Okay. So I would differentiate into two ways. One is, the main thing is when mother is delivered, there's too many suggestions from too many people. The number one, the 99% of mothers delivers in the hospital. Yeah. So the delivery happens with the healthcare workers support. Right. So the healthcare, especially the medical practitioners, 20 to 30% of them are very supportive at breastfeeding. And majority find a different type of advice will be given. So example I would give you. First day the baby is born, they will expect more milk, which is hardly few drops are expected. So sometimes they get confused and they say no milk, let us give something else. And in fact, when we go to see the droplets which is expected on a first day, that is more than enough for the child on a first day, actually doesn't need any external milk. So there the confusion starts. See, when the doctor says something, when the healthcare worker says something, that your milk is not sufficient, baby has to be supplemented. And then the lactation consultant goes and talks, it may not be that support, it's a real barrier.
Yeah.
Yeah, Nisha, I lost you for a few seconds. Yeah, can you hear me now?
Now we can hear you, but the video is not that clear.
Yes. So these type of, in the hospital itself, the mother get confused with the supply. And they say too many things are, fearful factors are discussed with them. So mother is finding it difficult to feed and manage with the breast milk. That's when the supplementation happens on an early day, on a first day. And the second barrier is the relatives who's with the mother. It's a family culture. They might say that when I have given a birth, first 3 days I have not given a milk. And somebody else, something else has been given. After that, I started feeding. But then the journey was, it may not be a full breastfeed, it must be a mixed feed. Because if we don't start the starting days to breastfeed, the supply obviously gets down. So then the baby should not cry. The immediately baby cries, they think milk is not there. Actually, baby need mother hug, mother warmthness, just to hold the baby. That's all baby need on a first day, which everybody forgets and look for a feed and feed. And the baby has been given extra milk. Baby does not know what is happening. The baby sleeps longer time. Everybody is happy, but the activities of other activities is disturbed.
Right, right, right. So, Ruth, you there? Stay tuned, mommies. There is,
Anisha?
yeah, it's better.
Yeah.
That's not the issue. I can understand. It's not an.
Yeah, so that's what I was trying to say. This is the barrier. So it is very challenge for the lactation consultant to convince the family, convince the healthcare workers, convince the mother to continue the breastfeeding journey. Yeah, this is initial breakup. For this again, if mother enroll herself antenatal workshop, antenatal counseling, then she knows what to think, what to decide, and she will take a right decision. So antenatal workshop is very, very important. Antenatal counseling is very important for the mother not to get confused or the couple not to get confused. Yes.
So, Ruth, help me understand. What is the biggest barrier that a mother faces? The first argument.
Yeah. The first hour feed, the moment baby is born, as early as possible, maybe half an hour to 1 hour time, the baby should put into the breast. This is just as the recommendation by WHO and research proved, and the babies has to put into the breast because they go through the first hour activities are entirely different. Just imagine, 9 months baby was inside the womb. One fine day baby comes out and the baby goes to beautiful warmer, beautiful cradle, beautiful clothing. No, that baby does not want all those things. Baby wants mother and just a hug and the warmth. So the baby, the first hour, the baby is totally confused because the baby is getting into womb life to adult life. So the lungs started functioning. The baby is totally confused. In this status, if baby is kept away from the mother, the baby will become more cranky, more irritable. It leads into many other issues, medical issues. So you allow the baby to go to the breast. Even baby suckles, even mother has milk, no milk, doesn't matter. Allow the baby to go to the breast. And the baby will root, smell, and visualize the black portion and start suckling. This is what God-given natural instinct. You and me cannot obstruct that fact. And then you should help the baby to go to the breast. After a few minutes of feed, the baby should be given skin to skin along with the mother, not to separate the baby on a first hour. So it is very, very important. The first hour, the baby is away from the mother. Baby becomes more cranky, more irritable. Because baby is cranky and irritable, what happened? The mother becomes more anxious. Because she becomes more anxious, because she is unable to carry the baby, because she just delivered, and her vital parameters can get disturbed. She can bleed more, her BP can fluctuate, and she becomes restless. The steroid cortisol level can go high from both of them, things can go bad. So allow them to be together. It calms their life. The bond helps both of them, and then the baby calms, mother calms. So that journey of first hour and second hour is so awesome. She forgets all her pain because baby is calm.
Right.
Yeah, it's very important. First hour.
This was for the first hour birth, right? So what is the
Yeah.
journey that a mother needs to track the first week of breastfeeding?
Yes. And one more thing I have missed out on the first hour, the very important, usually I talk to the mothers. When the baby had mother food for 9 months in the womb, the same chemical is come onto the breast on the first day, on the first hour. So the baby will not get confused though the baby is outside. And moreover, the VVVIP arrival to this world. So how do we expect someone VVIP come to our house for a week before, for a month before, we get prepared and we keep a requirement to meet that person, to satisfy person, to comfort the person. How much we do the person who's grown up. An example, marriage preparation, 1 month, 2 months. Wow, there's a different family is going to come together. And so the awesome preparation is well prepared. Same manner, this baby also 9 months have been expected. Once the baby comes out, how do you invite this child? This child needs something very important gift. That is gold. That is called gold liquid. That is from the mother's breast. So this child should be invited to this world by giving.
Stay tuned, Mom.
Have been clear?
Yeah, now it's clear.
You have been.
So
Yeah. Can you hear me now?
yes. We want to question.
Nisha, can I go to the other question which you have asked?
The next question is, what is the real journey mother needs to travel the first week of their breastfeeding?
First week of life.
First week of breastfeeding.
Okay. First week of breastfeeding.
Yes.
Is that your question? Okay. So, having said that first hour feed is so important, after that the baby should be given subsequently whenever baby demands. The first day the feeding has to happen. It could be on demand. Baby can sleep because how mother is tired, baby also tired on a first day. The baby might need 2 to 3 hours of little bit of milk, whatever she is having, or even she does not have, need not worry. She should put the baby onto the breast. Lots of skin to skin, she has to give on a first day. That's all required for that child. Even mother is not having enough supply or no supply. If baby is having good weight and term baby, mother did not have any bad obstetric history. These babies need not be given anything in the name of no supply. But the baby has to be given number of hours skin to skin contact. The minimum number of time the baby should go to the cradle. So the more number of time mother hugs the baby after the empty breast suckling or normal milk production breast suckling also, the skin to skin helps mother and baby quiet, calm, and that helps the minimal weight reduction on a second day, and then the baby does not get into hypoglycemia, that means sugar level drops. This was the more fear from the medical practitioners, if mother does not have milk supply, the baby can get into hypoglycemia. To prevent that, on the first day, baby does not need much milk. Baby needs just skim to skim. With the skin to skin, if baby is cranky and irritable, then medical intervention is required. Otherwise, baby is calm with the skin to skin. First day, it is not mandatory the mother should be able to feed a good amount of milk. But then the second day starts. After maybe 24 hours of baby life, the baby and mother should learn how to position the baby, how to feed the baby. Because the second day, the baby has lost a bit of weight and the baby need good amount of feed. So since she kept the baby skin to skin, her production could have been well established without any medication. And by then the baby started suckling well. So the second day, mother should learn how to position the baby, how to attach the baby, whether her milk is sufficiently transferring into baby. These three things she has to understand, and she need help on a second day. That is what in Cloud9 we do after 24 hours of delivery, or 48 hours of 36 hours of delivery. Every mother has been visited by the lactation consultant or the senior the in charge, the lactation counselor, and we train them how to hold the baby, how to position the baby, how to attach, and as well as whether your milk is effectively transferring to baby. This is the discussion class. It happens every day in Cloud9. So that the second day the problem is addressed, and we train the supporters also. We involve the husband also for this program, so that he understand, he tried to support the wife, support the child while breastfeeding. That is very, very important nowadays. Partner also should be helpful while mother is breastfeeding. That is very important. So the second day session is taken, and we do assist if the mother is finding it difficult. And third day, if we understand if the baby is not able to drink well, or mother is not able to feed well, or due to anatomical issue with the mother end or a baby oral cavity, if these things are addressed, and we do advise them how to handle the situation after going home, because they go home by 72 hours of time. So that 72 hours of time is very, very crucial after 48 hours to that 1 week of age. So the baby go through many changes, physiological changes during this first week. So what happens after 48 hours to 72 hours? Baby jaundice, physiological jaundice also will start increasing, and then the weight also will reduce. Normally weight reduction is less than 9% on the first 3 days is acceptable. Every baby will reduce. Not to reduce so much, every mother should learn to put the baby every after breastfeed skin to skin contact. That will reduce the percentage of weight loss on the first 3 days. We have seen many mothers who does sincerely skin to skin after the breastfeed. The weight reduction has seen only 6% or 7% on a third day. Mother who is feeding and keeping the baby away, we will see more than 9% weight loss. Then the problem starts. So third day itself, minimize the problem, so that when you go home, this problem is not too much where you have to come back for the readmission. So the third day should be understood well about the feeding. If feeding is not happening, or there is an issue of weight loss, or something is addressed, or the jaundice is addressed, it's a borderline, the mother should know to breastfeed and as well as give little extra of expressed milk, mother own milk.
Right. Mommy, stay tuned with us. This truth will be back soon. There's some network issue. Yeah, it's better. Yeah, back. Yeah, please continue, Ruth.
Yes, can I continue, Nisha?
There is some network issue. We can't see you, neither
can I continue? Can I continue, Nisha?
Yeah, please go.
Yeah. So I was talking about if the mother has been instructed, the baby is having quite good loss, more than 10 percentage weight loss, or jaundice is borderline, immediately mothers and the parents will start weeping.
Right.
Actually, this is all normal changes. We
Right.
should accept it. So these things should be aware before they could give a birth, so that the stress level is reduced. So these babies need little extra milk to reduce the jaundice, to pick up little weight. So the extra milk in terms, her own milk she could express apart from direct breastfeed. This would help the baby to pass plenty of urine and plenty of stools, where the jaundice reduced through this way. So that's our first week is the challenge is the jaundice and the weight loss. If mother is not confident or baby is not able to suckle, this is the advice everybody should be able to take it and try to give mother's milk rather giving on something else. This is my sincere advice, and sometimes this is what we come across. The first week, if the moment they come to know jaundice, the moment they come to know the extra weight loss, they start topping up with the external milk formula. So that's where the baby start taking other milk and sleep longer period. Mother milk which start getting collected by third or fourth day, it leads to hard breast. Hard breast, heavy breast, painful breast, further to breastfeed is going to be challenge. That's when they have to keep coming to hospital. That gives lot of painful process for that mother. So it is better if you come to know you are not comfortable in breastfeeding. It is understood. You should be able to express also alongside of direct breastfeed just for a 4 days or a 5 days. By then the jaundice is reduced and the weight is picked up. You can stop all those things, get back to direct breastfeed. And if you have a challenge, you should be able to meet the lactation consultant who's nearby, who can help you on this process. So that will make your life breastfeeding journey awesome and easy.
Agree. So much I agree
Yes.
on this. Right guidance is always required. Should not
Yes.
guidance and giving up.
I'm not able to hear you, Nisha.
Am I clear now?
Yeah, yeah.
So I was saying right guidance is always important. We should always ask questions, ask for guidance rather than giving up on something.
Yes.
And that too breastfeeding, which is a must. Breast is the for baby.
Not able to hear you properly.
I mommy, are you able to see?
Now coming in?
You able to hear me now?
Yeah, yeah.
Right. So let's move on to our next question. I have explained about the first week, the first day. But is there any warning or any such problems or issues that a mother should be warned about, or mother should take care that she needs immediate help?
Yeah. The warning signs are there. If mother can understand, then prevention is better than cure. That's very painful, actually.
Right.
The warning sign on a first week, the baby may sleep longer and gets into dehydration and sugar level dropping and weight loss to the readmission to the hospital. So they should know how to take care of the baby feeding.
Okay.
The next thing is, if baby has been given external milk or the mother is not knowing how to effectively breastfeed, the milk can stay in and block the duct. That milk gland will be blocked. It will be so heavy and painful, and they try to do massage and express, do some no handling of the manual handling of the breast, which is not in a right way. So they land up with feverish and redness in the breast and the hard lump in the breast or bleeding nipple, sore nipple. These are warning signs. If mother is having painful feeding and she is coming to know the nipple is cracked and it's bleeding or sore, she should take a help from the expert how to redo the latch again. Sometimes what happens, they go take a suggestion and they try to put some medicine. That's what sometimes they call on the phone. I have a cracked nipple, I have a bleeding nipple. Suggest me some ointment. I will not tell. Because for crack and sore, The mother should learn how to latch the baby once again. She has to learn. Without learning, and she applies the medicine, the cracked nipple induce infection. The bacteria will get through the cracked nipple, bleeding nipple, and gets into the breast milk, and the bacteria very well grow in the breast milk. That's the breast milk is the best media for the bacteria to grow. So few days time, suddenly she will feel breast is very tight and fever, redness, lump. That is the sign they'll rush her. By then they get into a lump or a abscess, which they need surgical intervention. And see, the first week they are getting adjusted to the new life of being awake and feeding, learning to feed. In that time, breast is getting very painful process, and she has to come every day to meet her doctor and go for a surgical procedure to remove the pus. And she will not enjoy her baby by breastfeeding. It's really mental torture for a woman.
Right.
So every woman should know if she is trying to give external milk, she should be able to express her milk every 2 to 3 hours to prevent this hardness and the mastitis or abscess, what we say. So that that expressed milk could be given to the baby, so that the baby also protected from the readmission to the hospital, and their stay will be at home very comfortable. They can always come back and meet us again next session for the how to breastfeed the baby. That is better than both of them getting into trouble. So first week is a crucial time for a mother and baby. But if she knows how to feed the baby, in case if the feeding doesn't happen, sometimes it gets delayed. So in that case, what is the next alternative to protect the baby and protect mother's breast?
Right.
So this is what she should get addressed when she is going home. Yeah. So this is the abscess and the crack and sore is the major problem. If they delay and they go through 1 month of painful process, then the breastfeeding will be compromised. So that's where we are lacking.
Help me understand one thing. Just like you said, there are so
Yeah.
many.
Yes.
Able to hear me?
Yeah. Now I can hear you. Yes.
As you said, there are so many issues in the first day or maybe the first week, right? But that time the mother, for her good journey, maybe the hassles and issues are all right. Is it possible for a mother to have this preparation beforehand?
Yeah. Yes.
Preparation, is it possible?
Yes, yes, Nisha, which I was been talking from the first question which you have asked, the pre-baby no birth or antenatal counseling.
Right,
When they are 29, 30 weeks itself,
right.
as a couple, they should they should attend the antenatal counseling workshop.
Okay.
Yeah, hello.
Yeah, Ruth, we are able to hear you. Oh, the network again went. Just stay tuned with us, mommies. Back in. Yeah, please continue, Ruth.
Hello.
Yeah, Ruth.
Yeah, can you hear me?
Yeah, I can hear you. Please go ahead.
Can you hear me now,
Yes.
Nisha?
Clearly?
Your video is getting stuck.
Yeah, I know. There's some network issue from Cloud9 end. Mummies, can you all just confirm or just put a message if you all can hear us? Just stay tuned. Cloud9 will be back soon. I think they're facing some network issue. Okay, they have left. I think they'll be back soon. Thank you so much, Monica. I have, Ruth ma'am is not there because there's some network issue. She'll be joining soon. And I have read your question. We'll be taking up your questions. All the mommies, if you all have any question, please. Yes.
Nisha?
Yeah. Oh, it's my
Yeah.
better now.
Yes, yes. So for your question, yes, it's possible for the couples, especially new couples, should attend this antenatal workshop. Whichever
Right.
hospital they deliver doesn't matter, but
Right.
they should find a way to attend the workshop. There are many hospitals in Cloud9. We conduct MBA session, online lactation session, and in-house session, and physical consultations on antenatal counseling. They should be able to avail wherever it is available,
Mm-hmm.
and they should understand the first hour of feed and the first week of hustle. If
Right.
they understand, it's easy for them to post delivery, whatever suggestion they get it, they know what path they are in. They'll not get confused. Their
Right.
breastfeeding journey and parenthood, motherhood journey will be awesome. So most of the hospitals nowadays, they conduct antenatal workshop. They should avail this. In Cloud9 we do conduct. They should be able to. That's what we insist. Every mother who books it at Cloud9, we want them to avail these facilities. Though sometimes, many number of times, we insist them to no, attend, but they don't understand the importance of attending the allied service no, before delivery. So I would no, advise any mother, every new mother should attend the antenatal counseling, so that they are well prepared what to accept during that first week of journey.
Right.
Yes.
Also, a lot of this term that is always used in breastfeeding, what is supply and demand.
Yeah. So today also, Nisha, I had one patient
Okay.
in the morning before this. Um, the demand and supply, how much ever I'm trying to tell, she's not able to understand. So
Oh,
like that only most of the mothers. See, the first 2 weeks, the milk is immature. So the more, baby keeps drinking, keep drinking, and then baby passing urine and stool. That's when the jaundice and the natural process, physiological changes will get improved with that. So once baby is better with the jaundice and the weight gain, the milk turns into mature. So the maturity period, what happens? There's two way of looking at it. The first week is called endocrine control. In a medical term, we call it as endocrine. And once the milk mature, the baby is growing well, the hormone understood, then it turns into autocrine control. Endocrine control, the hormone controls the increasing the supply of the milk on a first week. That is why we tell, put the baby into the breast, put the baby into the breast, then only you decide of giving something if there is requirement. So the baby doesn't suckle also, we tell them first week, do every 2 hours expressing the milk, so that the supply will maintain. So during this hormonal period, that's called endocrine control, if you don't feed frequently, occasionally you feed, occasionally express the milk, then the autocrine control, the maturity period, the milk will start reducing.
okay.
So the more formula, more supply comes down on a first week. That is why there is a medical indication for anyone to give external milk. If
Mm-hmm.
extremely mother is not producing, even empty breast, we ask them to express it every 2 hours. Naturally, she will start producing this supply, so that during that hormonal control, the baby should suckle and the more of expressing should happen. Then the supply will maintain by 2 to 3 weeks time. So once the baby is taken complete breastfeed on a first week, and
Mm-hmm.
the baby is growing very well with the breast milk, and the baby has not been given anything, or the mother has been expressing to maintain the supply on a first week, obviously the next few days time baby will start suckling. These mothers will start finding it softening of the breast by 3 weeks or 4 weeks of age, baby age.
Right.
So they feel the engagement, the hard phase is reduced.
Mm-hmm.
So they feel the supply is reduced. So
Right.
every mother should understand the hardening of the breast, 80% gets sorted out by third week or a fourth week of baby birth. So the breast goes lightening. So most of the time they get misunderstood. Oh, I don't have milk. They go for external medication. They ask the doctors and get the medicine done because they're saying that first 2 weeks I had a hard breast. I always felt full, and
Right.
now my breast is soft and baby is asking more frequently. So am I not producing sufficient? Maybe I'm not producing. So they start seeking help from many people, and they'll end up in different not good right advice. So what I wanted to say here, the more baby suckles, the more milk will come. So that demand and supply, it starts under autocrine control. So no more hormone takes a control over it. So that's why the hardening of the breast comes down. The baby, whenever baby demands, even the breast looks very soft, as if no milk is there. If the baby goes and suckles, baby will get beautifully supply done. It's called tailor-made supply. And the moment baby keeps the saliva into the nipple, the um, the hormone gets stimulated through the nerve endings, which is situated next to the nipple. And
Right.
immediately the hormone will start producing the milk. That information is given to the breast, production and expulsion of the milk. So this happens simultaneously. So the baby will be satisfied. Only mother is not satisfied because it
Right.
is not heavy. So demand and supply, the breast will not be heavy. Whenever they feed, milk will come, it will never stop. If mother has been putting the baby every now and then for the breastfeed, not giving anything else. Yeah, if she doesn't feed for a 4 5 hours, see sometimes 1.5 2 months old babies, they sleep little longer. So when mother is not feeding more than 4 to 5 hours, the breast goes little harder. Other than that, when the baby is drinking every half an hour, every 1 hour, every 2 hour gap, breast will be light as if there is no milk. But baby will get milk. Mother should be able to breastfeed. This is called demand and supply.
So, as I also said earlier, that by the time a baby reaches 6 months, there are a lot of mommies who gives up breastfeeding. Someone says that they were really concerned about the baby's nutrition. Someone says baby's weight. Someone says the mother milk is not sufficient or not enough to provide everything to a mother. So what are your thoughts on this?
Yes, Nisha. The recommendation for only breast milk is for 6 months. Once they complete 6 months, they can start the complementary food. That is the advice. Definitely, the milk won't be sufficient to take care of baby development. So they will start the complementary food. Along with the complementary food, the breast milk should continue at least for 2 years. So how the breast milk helps during this complementary food? It is like, the nutrition part of it, it will never reduce. But the
Right.
baby need little extra support of taking a solids. So they should be giving more focused on solids and then give breastfeed also alongside alternate feeds, or as the day baby grows big, the breastfeed should continue. So they should not think about short term of weight gain. Of course, weight gain is very important, but once the 6 months cross, the baby activities are too much. They'll start crawling, they'll try to sit. So they'll burn lot of calories, they'll try to talk, they'll do lot of cycling with their legs, and they try to take the leg, try to take the hands. Lot of energy they'll burn. So that is why they need complementary food. Sometimes what happens, the complementary food is not given properly, like the consistency, frequency, the quality, the calorie intake, these things are not taken in proper concern. So that is why the baby with the breast milk, they don't put on that much weight after 6 months. So if anybody feels my baby is not gaining weight alongside with the breast milk, they should not stop the breastfeeding. They should consult the nutritionist who can guide them how to introduce solids, and the quality, quantity, consistency, frequency, every month, every week, it will keep changing. If they keep doing that and then continue breastfeed, definitely baby will grow very well according to their the child requirement. And one more thing, they say if I'm breastfeeding, baby will not eat something, so the weight gain is not happening. let me stop. That is also some of them we heard.
Yes.
No, you focus on solids, continue breastfeed. Sometimes what happens if single no, mother is all alone and there is no help is at home. Before she could prepare, it's easy for her to take the baby to breastfeed anytime. So sometimes she doesn't concentrate in giving solids. So the practice is not happen from 6 months. That is why the babies will cling on to mother and they don't gain weight. And nobody is happy end of the day, pediatrician or you. So what happens? That's when they tell you to stop the breastfeed, concentrate on the solids. Please don't do that, because 6 months time, when you introduce solids, you will be introducing gluten, and this can cause gluten disorders and food allergies, and there is intestinal problems. These things are taken control over the breast milk. That time hardly they take 2 minutes, 3 minutes, 4 feeds or 5 feeds in 24 hours. It will not be a time consuming breastfeed. Lovingly they take
Right.
a feed. This is very, very essential not to have these complications which I have mentioned before. So 1 year time it is very important. After 1 year, mothers should be able to reduce the day feed, because what happens, they'll be clinging on to mother. So they don't eat anything because they feel mother's milk is the best and very tasty. The child understand that age, so does not want to eat some other food. So they try to give more of breast milk. Then again the weight will be
Mm-hmm.
compromised. So as the day goes, 6 months itself, start simultaneously, slowly, slowly solids and give breast milk. And daytime, if you're a working woman, it will become more easier because you are not available. So during that time, baby learn to eat solids. When mother comes back, she should be able to breastfeed. Whatever time she is available, she should increase the number of breastfeed. If mother
Right.
is at home handling the baby completely, then a little bit of challenge if she is compromising at times to give solids. Later on, baby will not take solids. They prefer mother's milk because they keep suckling, they keep getting the milk done, but that will not be that much protein or a fat to put on too much weight according to their activities.
Right.
So
Right.
that is why the first year age, if any mother thinks that I'm not able to get baby weight gain, tripled weight gain, she can reduce the breastfeed during a daytime. She can give evening feed, night feed, and continue good feeds during a daytime, solid foods, and then she can continue for 2 years. So the first year to 2 years of benefit, I always tell my mothers, most of them they will get discouraged by many people. After 1 year, your milk is no value. There's just a water. There's no nutrition. I feel
Yes.
sad for the mother. I feel sad for the babies. If they are able to verbally tell it, if they are able to attend the session, definitely they would say, I want
That's
mama's milk
the only thing
for
they
2 years. Yes.
definitely.
Yeah. So
Definitely.
yeah, first year to 2 years, if they breastfeed maybe 2 times or 3 times in the evening or
Right.
in the night in 24 hours, that will help the oral cavity to develop well. And the vocabularies will be plenty by age of 5 years. The academically they'll do very well. Extracurricular activities they do extremely good. Though they are not very attentive in the class, they do very well because the common sense will be very, very good. So
Mm-hmm.
parents will be asked, called in the school. That's what I tell. How did you all make this child to learn so much? The vocabularies will be plenty because they have been breastfeeding. So the awesome benefit the child will get after 1 year of feeding. Though the other benefits, nutritive value is not much. Immunoglobulin is there to protect the child from any infection throughout how long she breastfeed. And then the multiple language they pick up very soon. Any part of the place you leave them, within few days they will learn the language. That
Right.
capacity. So why not breastfeed 2 or 3 times to get so beautiful benefits which we can't pay and get it? Yes, that's what I would advise. Continue
Very,
breastfeed at least for 2 years. Yes.
so I'm sure mommies who are listening to us and joining us, they are gonna listen so many benefits and they are gonna continue breastfeeding for 2 years. So moving on to our next question. As we know, you have been guiding induced lactation. So what is it all about, Ruth? And Is it easier? Is it possible for a mom for go for induced lactation?
Yes, Nisha, induced lactation is possible, and very few of them are aware of this induced lactation. So
Mm-hmm.
many of the mothers do, they come to me. So if any mother aware, if they want to adopt a child, a newborn, I would encourage every mother to take the baby to breast. All of them should understand the baby who adopted newborn baby, that newborn instinct, which we are talking about, newborn instinct, which God has given to that child during a development period in the womb. You go out, you smell mama, you root the nipple, you visualize the black portion, that areola part, go suck, swallow. All the sense has been developed by God in nature. That because you adopted the child, that doesn't mean that you don't have milk and the baby has to be given in a different way. So I would encourage every mother, just empty breast, you put the baby onto the breast, and then you give what you want to give. That is number one advice, mother who is not able to get done induced lactation.
Mm-hmm.
So as they're demanding from day one, first hour itself, take the baby to the breast, feed, give lots of skin to skin, and then give what you wanted to give.
Right.
This is so that the child is using the talent which is God has given, so that their IQ level will be good. Otherwise, it's going to be very dull. Yeah. The next thing is, if mother wants to breastfeed, yes, it's possible. And if she doesn't have any medical illness, yes, definitely she can approach 3 or 2 months before itself to the concerned lactation consultant, and definitely we can help. And it is mother who's convinced to breastfeed, she can very easy way of handling to get it induced lactation. So
Right.
3 or 2 months before itself, she should get a counsel, and definitely the day the baby is born, she can start the breastfeeding. There will be a supply, though she has not delivered. So there's very simple technique of pumping, and there are certain things which she need to take a one-on-one counseling. Then we will understand her medical condition, her health issue, the status of that. Then we can guide accordingly. Definitely any mother can breastfeed the baby. Some of them, I have mothers who's fed 6 months exclusively from day one with this induced lactation. Some of them for 3 months, some of them it's a partial feed. How well you prepare. The earlier you prepare, the longer you can breastfeed. Very short time you prepare, then what I said, at least to take the baby to breast,
Mm-hmm.
and then give what you want to give. So every baby is privileged to go to nipple to suckle, give that privilege. If you have a time or if you prepared mentally, please meet the expert who can help you on induced lactation. Yes, it's possible.
So, the next one is difficult to relactate. There are a lot of mothers who face this problem. Relactation is difficult.
Relactation, it is not difficult. When there is a induced lactation itself, we can do better. Relactation, mother is already delivered and she has the hormone in it, she can do it. But within a month, most of the time we come to know a mother was sick, separated from the baby, or mother gone into the breast lump, breast abscess. Sometimes they stop the breastfeeding, and then she realized baby is on full formula and falling sick. Baby is falling
Mm-hmm.
sick, often with the formula, not able to adjust. They do come back for a relactation. So
Mm-hmm.
that is really possible if they come within a month or two. If they come,
Okay.
within a month, it is very, very easy. And after 2 months, it takes time, but then she can establish the supply. Slowly it can pick up. But there is a
But
work behind. Yeah, she
yeah,
should be dedicated to
proper.
do that. Yes.
She needs a proper
Yeah, proper
guidance, external
guidance is very
guidance.
important. They come one time and they do counseling and they don't do things what we ask them to do, then the relactation becomes challenge. because they have a big baby in their hand. They have been handful of things to do. So it becomes more easy for them to give it through bottle then. So mother who decided to relactate, yes, it is possible. She has to take a proper guidance. Yes.
So as so far, whatever we discussed, these were all advantages, good points of breastfeeding. So no one talks about it, but I would definitely like to raise this question. What are the disadvantages of breastfeeding? There are few.
Nisha, disadvantage in the sense new mothers will start getting frightened.
No, no, no.
Uh,
We are
yeah,
talking,
I would,
we said
yeah,
a
I would,
same topic.
yes,
No one said it will be
yes,
easier. Something that's
yes,
not easier but always come with some kind of pain. So it's
yes.
definitely like
So,
you to guide us with this.
yes. So without pain, no gain. Yeah,
Definitely.
let me tell you this. So the mother who's constantly, yes, who has to start the new journey. As I
Yes.
told you in the first question, she has to get adapted to the new lifestyle, new change in her body, and her new family adoption. Yeah,
Right.
so she should come to know that the baby is not going to sleep on a first month how everybody sleeps 6 hours, 8 hours long stretch. So sleep deprivation, if the mother is not able to understand this pre-pregnancy or pregnancy period, and then she decide, oh my God, my baby is crying mostly at night. I am not able to sleep. Everybody is sleeping. Why should I wake up and feed? Let others feed the baby. This is what happens when the mother gets into postnatal depression. Yeah. So the sleep deprived is the major problem during this the first month. So I would tell you, any new mother, see anybody when we are housewife or working from home or working outside, whatever it is, we have a rest at least 6 hours or stretch sleep 8 hours in the night or during a day, whatever it is. Mostly it is night. So here one human is have been designed to sleep 6 hours 7 hours one stretch. Suddenly one fine day you have to get up every hour, every half an hour to feed. She get totally get disturbed, and then she wants to go out without baby. She can't go beyond 2 hours. She has to come back and her breast will become heavy and she's not comfortable. So
Right.
these things should be addressed during antenatal period. So the first month, during 9 months of pregnancy, the body go through lot of changes for the woman. It's not only mentally, just physically also, emotionally also. Too many changes, vast changes for the new. So in that case, once the baby is out, the body has to get back to the pre-pregnancy stage. It takes 6 weeks. So to get back pre-pregnancy stage, mother need complete rest. So rest in the sense everybody thinks in terms of sleep. Actually, no. When you and me have to sleep, we get 6 hours at times 5 hours, at times 7 hours. One day we will not have sleep also due to various reasons. But here, mother, every time she feeds when the baby sleeps, she is permitted to sleep.
Right.
Nobody will ask, why are you sleeping at 10 a.m.? Why are you sleeping at 7 a.m.? You are getting up time at 9, have a breakfast. Why don't you sleep in the night? Why are you sleeping in the evening? Odd time. Nobody will ask. So whenever baby is sleeping, awesome rest she is going to have. So she will have 1 hour break, half an hour break, 2 hours break. Throughout 24 hours, she is not been given any work except baby feeding. So the body gets naturally get beautiful recovery to get into her lifestyle how she was before.
Right.
If she is not going to take care of this rest, sitting and feeding, lying down feeding, and enjoy only feed, rest, that's a beautiful rest in woman in her life. She'll get only breastfeeding time. She will never get this type of rest in her life. So she has to take a positive note on this, and she has to, and then her body also has to recover. It takes complete rest. So if you start giving other milk, baby sleeps long time, you tend to do other activities at home. You can't keep resting and sleeping a whole night. You slept 6 hours, and day also you can't take rest. You tend to do some work, and your body is not getting prepared proper rest because your activities are more. So if you breastfeed, nobody will give work because you have only time to breastfeed and eat. So I will recommend any mother for 2 months, wherever you go, take the baby and go. It is not restricted that you have to sit at home and feed. Once you know how to breastfeed, start moving, visit your friends. Now because of the infection and the virus, you can't go to the crowd, but keep visiting your friends and close relatives. And then so your mindset will be different. But go with the baby. Feed. This movement you will not get into your life again. So enjoy this breastfeeding time. You will get only chance for 2 months. After that, baby will start giving lots of break and you will start doing your own work. Your body is adjusted to the pre-pregnancy. And so things will move different way. You will get adjusted to the lifestyle. That's what I would recommend any new mom who comes with sleep deprivation. Yes, and then going out, eating. They can eat anything. Maybe for a few months, she may have to avoid the food which is cooked from hotels because we don't know what type of oil they use. If she wants the boiled ones, steamed ones, she can have for a change because some of them they always try to eat outside. Suddenly you restrict them, they get frightened because you are breastfeeding. You can't eat. That's why they get very much offended. So you can have, but try and avoid oily food. The same thing you can ask your friends to prepare, ask your relatives to prepare, ask your mom to prepare, so that you can eat and enjoy and keep moving. Go out, enjoy, go with the baby, so that you will not restrict in between inside the four walls. Yes.
So my point was that only, and very well explained also, Ruth. There are no disadvantages breastfeeding mommies, except that it needs your time, it needs your patience, it needs your dedication, and at the same time, it needs you to rest, and definitely breastfeed, and breastfeed. That's the only two things you should be doing for at least first 40 days of motherhood. So moving on, Rudra, as I did my study, I read about the topic also. There were a lot of common breastfeeding issues that generally comes across to a mother once she starts her breastfeeding journey. As the time is also restricted, we are already at 1:11. I would love you to just give me simple answers for every breastfeeding which a mother can quickly grasp and can go for that thing. So, for example, the first one is milk supply, whether it's low or it's excessive milk supply, what a mother should be doing.
So milk supply on a first week you have to deal.
Okay.
If baby doesn't suckle, milk supply is not going to increase.
Right.
So if you feel the baby is not suckling, every mother should learn to express the milk every 2 hours till baby suckles. Yeah, can you hear me, Nisha?
Yes.
Can you hear me?
You?
Yeah, regarding milk supply, you have to start from first week. So if mother keeps the baby many number of times as baby suckles, the milk supply will never decrease. If baby doesn't suckle, the pumping, the expressing milk should happen on a first week every 2 hours to maintain the supply. This is very important to maintain the supply. Yes.
Second one, as the global data says, around 32% latching issues. What is the
The latching issues, yes, that too we face. That is why I said in Cloud9 we have a class. We teach them how to attach. The latch is the entire black portion should go into baby's mouth. So the new mother should learn. So that she need a help. Though the breastfeeding called natural art, but it is learned art. So she need to learn. So the latch, if she learned on a first day or a second day, I don't think so there is a problem with the latch further. Only the 3-4 days they'll have a problem. After that, baby will do by himself or herself. Yes.
breast infection.
Breast infection, again, the first week, if mother is not able to latch well, if the baby is feeding at the nipple, the cracked nipple and improper emptying of the breast can cause mastitis and breast abscess, which needs surgical intervention, many times coming to hospital. This causes stress level high. So again, for this solution is feed frequently. If you have a challenge, painful feeding, that no one should experience while feeding pain. If there is a pain, there is a problem.
The next one is
So that has to be taken care. Yeah. Come again, Nisha. Yeah. If baby is not able to suckle well, the mother should know how to express and keep the breast off. If painful feeding, mother should come back and take a help. Again, how to latch again.
Right.
So these will prevent breast infections.
Okay. Baby sleeping at the breast.
Yeah, baby sleeping at the breast is more common on a first 2 weeks. Okay. So baby, all the babies, when they come to breast, they suckle, they sleep. That is the way they behave. And 5 days, you should give them a break. After they suckle few suckles, they become tired and they close eyes only, they'll drink. That is not called sleep. But more than 5-6 seconds, if they continue to sleep, the mother should be able to tickle ear, tickle feet, or take the baby away from mother's breast, the baby gets up and feed again. So this is common behavior of the newborn babies. But having said that, some babies, they'll only start with the suckling. After that, they'll have a deep sleep at the breast. However you tickle, they won't get up. So in that case, you need to take help from the consultant, lactation consultant. Yes. Otherwise, normally every baby will sleep at the breast. You have to keep tickling to complete the feed. That's common. Yes.
Okay, so the next one is baby pulling away the nipple.
Come again?
The baby is pulling away the nipple.
Yeah, pulling away from the breast is usually happens after a month. So when the demand and supply starts, when the mother, baby could have stimulated the supply, the letdown will start. Fast letdown. Okay, so it is called when the baby starts suckling after a few minutes, milk will start throwing into baby's mouth very fast. So some extent they will be able to suckle, but some extent they will not be able to suckle. So they pull the breast and come to the nipple. Again they'll go back. Again, that's commonly it is seen in fast letdown mothers, and there are different techniques to feed. They should take a help if they are not able to do. Yes, that could be addressed. And slipping off from the breast, again, for a first week or 2 weeks, if that happens, that means the baby oral. Yeah, can you hear me, Nisha?
Yeah, we can hear you now.
Yeah, if baby is slipping off from the breast on the first 2 weeks, that means there is a problem with mother anatomy of the breast or baby oral cavity. That has to be checked by the expert. Then accordingly, there is a suggestion and guidance. They can do very well. Yes.
Right. So, nipple confusion.
Come again?
Nipple confusion.
Nipple confusion, yes. The first day to first, within a month, if they introduce bottle nipple and then they try to breastfeed, the baby will always look at long nipple, and the bottle nipple, what will happen? The baby has to suckle the nipple, milk will come.
Right.
Breastfeed means it is not called a nipple feeding, it is called breastfeeding. Breast means it is a tissue. The baby has to take good amount of black tissue, grasp and drink. So here the baby is very comfortably filling the stomach by only suckling nipple. And then next time you bring the baby to breast and give full black tissue, baby will push and come to the nipple. Nipple, obviously baby will not get any milk. So the baby will get more agitated and get back to cry, and then obviously mother has to give the bottle. So I would recommend try any mother, if the baby has to be given little extra milk by expressed milk or whatever it is on a first week or first 2 weeks, better to use the cup or a spoon or a palada or a syringe, whatever they are comfortable, they should be able to use so that the nipple confusion could be prevented. And one more thing, some of the medical practitioners, they are not very comfortable with a spoon or a syringe or a palada. They might ask them to use the bottle nipple. Why they say? Because some of them are nowadays, it's most of us, we see the new mom as a nuclear family. They don't have elderly people to guide. So these new parents, they don't know how to use the spoon or palada. Sometimes the baby is very sleepy. If they drop the milk, the baby can choke and cough and aspirate. Fear of that, they might ask them to use the bottle nipple. Definitely, if they have taken care and they have been taught how to feed the baby by spoon or palada, the nipple confusion could be very well prevented.
Right. One is baby fussy at the breast.
Come again? I'm not able to hear you.
Baby fussy at the breast.
No, I'm not able to hear you.
Once.
Your voice is breaking.
The baby is fussy at the breast.
Come again? Nisha, come again?
1 second. But, now it's better?
Yeah.
Better, right? The baby is fussy at the breast.
Fussy at the breast is mainly either they are gassy during feeding. So during that time, mother should not force the baby. Should take the baby and hold the baby on the shoulder and keep walking up and down by patting the baby back. The gas settles down and then baby will be put into the breast, baby will suckle. So fussy babies, they won't suckle, they'll keep coming out from the breast and they hurt mother's nipple. So during that time, baby is having some problem. Majority it is a gassy, colic, severe colic. So hold the baby, walk up and down vigorously for a few minutes. Then the gas settles down, then she can feed the baby. So the other one, fussy baby, is fast let down, which I was talking before. So when the milk is coming very fast, the baby becomes very fussy because wants to drink calm, peaceful. Here the milk is throwing, so the baby get agitated. So that's why they'll become fussy. So in that case, mother should reach out to the expert and learn different techniques to feed. This problem could be prevented.
Right. So, at the end of our, there are a lot of questions that mommies have asked. So, I would like to take them one by one. First one that by 2 weeks of age, my baby had fewer than 6 wet diapers and 4 days. Her urine is dark yellow and specked with red. Is it to worry?
Your voice was breaking in between. I have understood 2 weeks old baby.
Yeah, I think just
Can you hear me?
yeah.
Can you repeat the question? Yeah.
So should I repeat?
Yeah, you can. Can you repeat the question?
So by 2 weeks of age, my baby has fewer than 6 diapers and 4 per day. Urine is dark yellow and specked with red. Is it to worry?
2 weeks old baby, if baby is passing 6 urine, 4 stool, obviously baby is getting good feed.
Right.
I don't think so you should worry about it. And if too much red spots are noted, then could be informed to the pediatrician. Otherwise, if 6 to 8 urine and 4 stools, obviously the baby is doing well.
Oh, very
If this no bloodish color, if something like that, 2 weeks. First 3 days that is okay. After 2 weeks, if that is happening frequently, that means the feed is insufficient. Yellow urine is okay. But the red spots are noticed many number of times, then they have to inform the pediatrician. Otherwise, it's not allowed.
The next one, how many days be wait for the breast to be full?
Come again?
How many days post delivery one should wait for the breast to feed full?
Okay. See, the first 3 days, the breast will be light as ever. Only 2%, 3% of mothers will feel little heavy. If mother who's been giving skin to skin for the first 3 days constantly, she will feel full. Otherwise, every mother will feel full by after 72 hours of post delivery. That's when the milk start coming. The first 3 days is a colostrum phase. That's a high density milk. The baby need only droplets full of immunoglobulin. That's all baby need on a first 3 days. The third day only, the immature milk will start. That is when mother will feel heaviness in the breast.
Right.
So that is the phases of lactation. So it is in medical term we use during pregnancy the first phase starts. That is 16 weeks of pregnancy, mother will start producing milk. So soon after the placenta is out, the baby is delivered. That phase will continue for 3 days. That will be a colostrum phase.
Right.
And then once baby starts suckling, the second stage starts after 72 hours. Then the baby suckles, the hormone balance the supply according to baby suckling. And then the mature milk starts third stage. Then it will maintain, that's a demand and supply. So the heaviness they'll feel after 72 hours.
So there's this mother,
Yes.
she's asking how to reduce breast milk for baby.
How to reduce?
Breast milk for baby. Monica, you want to ask how to increase breast milk or to reduce the breast
So she's asking how to reduce the supply.
milk? Yes, how to reduce the breast milk for baby.
See, this is something little challenge question. Reducing supply is on a mother who's having over lactation or mother who's finishing the breastfeed and she wants to reduce. So there's a different way of handling. Maybe mother who's feeling over lactation after feeding also breast is heavy and she's not able to take care. The number one, she should avoid pumping. She should never use the breast pump and she should use different techniques, laid back position to breastfeed. And she can do block feeding. So block feeding means 4 hours to feed on one side and then next 4 hours to feed on other breast. So in that way, by 1 month time, the supply will get regularized.
Okay.
And the Indian technique of reducing little heaviness in the breast is using the cabbage leaves in the breast, avoiding the areola and the nipple. The whole breast could be covered except nipple and the black portion. If she keep using every 2 hours, keep changing it, that engagement part will settle down. But really, if she's having a problem in reducing, she should go and meet the lactation consultant. They will understand her history, age of the baby. Accordingly, guidance will be given. This is just I have given if she is having oversupply.
Right. Next one is breastfeed.
No, I'm not able to hear.
Does my baby needs a breastfeeding schedule?
Schedule. Oh, so there is no breastfeeding schedule as such. It is called token feed. The moment you schedule the breastfeeding will go failure period of time. So first week, what happens? The baby should be fed more frequently. So because they go through lot of physiological changes during this first week, newborn jaundice and the weight loss, the baby should be fed more frequently. Some babies, they have been wrapped more good and the baby does not get up more than 3 hours. They can get into very tired next week. So they won't perform well. So only for that first week, we do say on-demand feed, but the on-demand should not extend beyond 3 hours. Otherwise, once baby is crossed that problem after 2 weeks, regained birth weight, and the jaundice process is settled down, they should go as per baby demand only, no as per the schedule. It will not work out. So schedule should not be there.
That's not required.
Yes.
So moving on to the next one is how do I know my baby is satisfying?
Come again?
How do I know my milk is satisfying?
Milk is satisfied for the baby, isn't it? Yeah. Again, this is on a first week. The looking at milk satisfaction, because each mother doesn't lactate in a uniform way. So the quantity we will not be able to tell. So how do we measure the baby is getting sufficient milk is on a first day, at least we expect one urine, one stool on a first day. The second day, at least 2 to 3 urine in 24 hours. Third day, 3 to 4 urine in 24 hours. From fourth day onwards, 6 to 8 urine in 24 hours. This indicates the baby is getting sufficient milk. The mother is keep on feeding as per the demand, how we are talking about demand and demand. And the baby suckles and keep on suckling and the baby is cranky, the nappy is not wet adequately, then the baby that should be considered. So by measuring the urine output, you would say that the baby get the sufficient milk of milk, adequate supply. Yes.
So one of our mother is asking, how soon can I start pumping and giving bottles?
Come again, the question?
The question was how sooner I can start pumping and giving.
See, pumping, yes, mother can pump when she start going to work. So sometimes they are away from the baby for a 6 to 10 hours. So during that time, to maintain the supply, she can pump once or twice. She can have a hand expression will be ideally better because she need not carry the instrument and go. If she find it difficult, because I would recommend if any mother wants to go to work after 5 months or 6 months, most of the pumps are not so comfortable to remove the milk because the breast will be very light. But baby suckles, milk will come, but pump may not give the milk output. So they get discouraged. If they have one, they can try. If they don't have one, let them not to buy after 4 months or 5 months of post-delivery. They should learn how to remove it by hand. So during that working hours, like a once in 3 hours or a 4 hours, that means 2 break, the snack break and the lunch break. She can go to the restroom and discard the milk, or if she has a provision, her company is providing the feeding room and storage of milk, she can extract and keep it in the fridge. When she comes back, she can keep it in her fridge. When she's not there, that milk could be used for the baby. So this is probably when she goes after 6 months or 5 months, she can do that. Once baby start taking good amount of solids by 8 months, 9 months, because she's not pumping and she's not feeding during that period and very minimal pumping, she will not feel heaviness and to feel like expressing. But when she comes back home, she will have milk to feed. She should not feel because I have not fed for a 6 hours, 10 hours, my milk supply will compromise. She should not feel that. She should remember it is a demand and supply. The moment she comes home, the baby starts suckling, milk will be established. So the first month when she leaves the baby and go to work, she'll feel little uneasy, discomfort, heavy breast, leaking breast. For that purpose, she can express. And if she has a facility, she can store it and get back to the baby. Yes.
So we have this wrote Kinnari. She is asking disadvantages of pumping of breast milk rather than giving direct breast milk.
No, I have not understood the question. Come again.
Trying to ask us that which one is better, pumping the breast milk or direct milk? Or is there any disadvantage of pumping?
Pumping, see, end of the day, direct breastfeeding is the best. Yeah. So when you have to pump and feed, as I've discussed, that natural instinct which we are not giving. See, completely, I'm talking about completely pumping and feeding.
Right.
Working mother, when the mother is away from the baby, she pumped and she comes back and she feeds directly. That is different. But mother who decided to only pump and feed, not to feed directly, then the direct feeding has got a way benefits. Like
Right.
breastfeeding benefits are different, breast milk benefits are different. So baby is able to suckle at the breast, the best option goes to direct feeding.
Correct.
For some reason, anatomical issue, mother is not able to feed. At least something is better than nothing. Breast milk could be expressed and fed. But the first place, breastfeeding is because you are activating the talent which God has given. So the IQ, brain development, visual development, growth development will happens if the baby suckles at the time.
Right. Right. So moving on to the next one. Should breastfeeding
Breastfeeding?
hurt? Or maybe is
Breastfeeding
it
hurt? No. Breastfeeding? No. Breastfeeding is not painful, provided on a first week they learn how to latch. If the latch is not proper, it hurts a lot. So if they learn how to latch, there shouldn't be any pain. If there is a pain, they should approach the expert and learn how to feed. They can feed pain free.
so
So
we
there
have
are
Vinu.
different aspects. Yeah.
Yes. No,
There
please go
are
ahead.
there are different cases. The breastfeeding, the latch is improved also, it hurts that due to some anatomical issue. Different techniques will improve the feeding without pain. So basically it is a latch.
So we have Vinu Priya here. She's asking less milk production in one breast. What should what should
Yeah.
be doing?
See, usually both the breast doesn't produce equal amount. Always there is a variation, but it will be 20 to 30 ml difference. But sometimes you will find huge variation from one breast to another breast. Little differences, that's common, but huge difference from one breast to other breast is probably she has not fed the baby more frequently on the particular breast on the first week.
Okay.
She must have been very comfortable on left breast. She must have fed more number of time left breast, and the right breast she must have fed very few time. So after that an autocrine control, the demand and supply starts, how much is stimulated on a first week, that much variation you will have. So the baby is not being fed equally, the supply differs too much. But little supply difference will be there. That is common.
So moving on to the next one. Can I give my newborn pacifier while breastfeeding?
Come again?
Can I give my newborn pacifier while breastfeeding?
No, I'm not able to hear.
Can I give my newborn pacifier while breastfeeding?
Pacifier. Okay. No. Newborn baby, if you give pacifier, breastfeeding will get affected, confusion. Baby will not put no strain to suckle at the breast. So avoid pacifier. That is my sincere.
So we have one mother here. She's asking, she's 13 months old. Up to how many months can I feed her? And after stopping the breastfeeding, can I offer cow milk? How many times?
She's 13 months, isn't it?
30.
1-3. 1-3. Yeah. So she can continue for 2 years and above also. But make sure that she feeds the solids. Alongside solids, she gives the breastfeed. She can complete 2 years and 2 years plus also she can go. And once she try to stop, she can, after 1 year, they can introduce cow milk. The cow milk could be given. Normally, everybody takes morning or night. That's all. Too many milk should not be given. The baby should be given other. Yeah. After 1 year, cow milk they can introduce.
Right. So the next one and the last one for today's session is, do hiccups means the baby is full?
No, it's not always. But that is again common.
Right.
And some babies, they'll have hiccups and they'll be quiet. Just leave them alone. Some babies, they'll have hiccups and then they cry. You can cheat. It is not that they are full, that is why. Or they say that the baby is growing, that is why hiccups. Actually, it is the baby internal, the stomach capacity and all those things. the baby will have this type of hiccups. It's absolutely normal. If baby is cranky during that time, they can take the baby to breast. Otherwise, there is no other intervention. It's
Right.
normal. Take it easy. Yes.
Right. So, Ruth, all the questions are here. Just one last one. Does breast time
No, I am not
does
hearing you.
breast
Yes.
cure with
No,
time?
voice is breaking. Come again.
Does breastfeed gets easier with time?
Yes. The first week you learn latch, and then once you start feeding, as usual, it becomes so easy. After 3 months, anywhere you go, just have the baby with you. And they take 3 minutes, 4 minutes feed. Stomach will be full. No more sitting half an hour, 1 hour to feed. So it'll become so easy. You can travel with this baby anywhere. No need a flask of hot water and different type of bottles, different type of powders, expressed milk, pump. So many things you have to carry and go if you have to go for a long journey. So direct breastfeeding is so easy, and they take very few minutes feed, and they play and they enjoy, and mother has stress, and if she is going to feed, all her stress comes down, especially working women. When she comes back, the child comes, 1 year old child comes and take the mother to the room and give a pillow or however they want, and they try to take a feed and they communicate with the mother. Whole stress level, just like that, it will drain. So it becomes so easy. And sometimes they fall sick as they grow big, 6 months, 9 months. They'll have loose motion, teething, and other infections. So if mother is able to breastfeed, you can prevent hospital admission. So that way, and the mother will be able to manage the baby with the breastfeed because she's continuing to breastfeed. It becomes so easy. Sometimes they'll be very naughty, they fall, and they have get into some injury, and they scream. To pacify it is very difficult. Here the mother comes and hug and a little bit feed. Wow, the baby forgets the pain. And any small procedures, if they have to do for the 9 months plus babies, little bigger babies, they won't allow somebody else to touch because stranger feeling. So if mother is next and she's feeding, and then the procedure is done, baby doesn't have any problem. So it's so good. As the day advances, the breastfeeding becomes so easy for anything, everything.
Right. So the last one is this one mother. She's asking, please suggest a good breast pump device. Is there any suggestion that you would give for the breast pump device?
Breast pump device, see again, it is case to case. So what I would recommend, if there is a requirement for the pump, first you have to get examined your nipple size.
Okay.
And how frequently you have to pump and how long you have to pump. So accordingly, if it is a short term and the nipple has to be measured, there are company pumps very good if they can buy, not the local pumps. If the baby need long term of pumping and feeding, it's better to go with a good electric pump. They should not buy again the local pumps electric. What happens if they pump many number of times with that pump? The tissues, breast tissues can get damaged.
Oh.
Once or twice who's pumping thrice, it's okay. But period of time, every 2 hours, if you have to pump, it's better go with the company pumps. Little expensive, but that will be better so that the mother doesn't get into trouble. So it's better we go with the suggestion from the respective no, guidance and support, where there is a requirement. Accordingly, the suggestion will be given. Short term and all, there is no need to buy actually. There are rental pumps are available. Just for a week and all, you don't need to spend money. So if there is accordingly the situation how it is, it's better that go accordingly. There's nothing like good and bad, but don't land up in getting local pumps. That's my sincere.
I think this session is gonna be a non-ending one because the mothers are just pouring in their questions. We'll bring the session to an end for today, mommies. Thank you so much for joining us. Thank you, Ruth, for such an informative session today. I'm sure all the mothers who have joined us, they must have got so many things to know, to understand, uh, where they need the guidance, apply, how they can think about the breastfeeding and everything.
Thank
Thanks,
you. Thank you so much. Thank
thank you,
you.
Cloud.
Yeah, all the best for the new moms. Yes.
Thank you so much. In the end, I will to share with you all, breastfeeding, as Ruth said, is an art on the canvas of motherhood with a palette full of nourishment. So please, mommies, use your brush of confidence, frame it with our experts' right guidance, experience, and enjoy your motherhood journey. Thank you so much once again, Ruth. I would like to thank Cloud9. Thank you so much, Ruth. Have, bye. Take care.